Good morning. Today we'll be talking about processing disorders. And My name is Darcy Solom. I am the postdoc coordinator for the Northeast region of North Dakota. Um, so today we'll be talking about the three different types of processing disorders: auditory, visual, and sensory processing. All may seem to be a bit similar in some respects, but they're all very different. We'll review the following information about each disorder. We'll talk about the diagnoses, what it might resemble but isn't, the various types of each disorder, the signs and symptoms to be aware of, the causes of each disorder, how to get a diagnosis, how the disorder affects a person in their day-to-day life, treatment, and then how to support a kiddo if they have a processing disorder. It might seem like a lot of information, but trust me, it's laid out in a pretty easy to follow format. To start off with, we'll begin with auditory processing disorders. Auditory processing is the recognition and interpretation of sounds by the brain. Auditory processing disorder is a deficit in the neural processing of the auditory information in the central auditory nervous system, also known as the CANS. And this is not related to or caused by a higher order language or cognition disorder. So you might ask yourself, what does that even mean? Basically, people who have auditory processing disorder, or APD, have a difficulty receiving, organizing, and using auditory information. Individuals can hear what is being said, but the information becomes tangled up in the auditory nervous system, and this is not related to a disorder of higher nature, such as autism. So auditory processing disorder is not, like we just mentioned, it is not an auditory deficit resulting from a higher diagnosis such as autism. ADP is not the same as ADHD. Individuals who are diagnosed with APD are not choosing to ignore. It might seem like sometimes that all of our kiddos might have an auditory processing, but that's not the case. And individuals who do have auditory processing disorders, they're not choosing to ignore you as the parent or as the caregiver. And finally, these individuals do not have a hearing problem, such as deafness. There are 5 different types of auditory processing disorders, and they include auditory hypersensitivity, phonetic decoding, auditory integration, prosodic, and organizational deficit. Symptoms of auditory hypersensitivity include not hearing well in a busy or noisy environment. There might be missed steps when listening to multiple step directions, and individuals may appear to be ignoring those who are speaking to them due to their need to concentrate so hard on what is being said. Symptoms of phonetic decoding include difficulty sounding out words, confusion with similar sounding words, which leads to potentially learning wrong words, learning words wrong or incorrectly. And then there may be difficulty with speech clarity and articulation, as well as poor spelling. For example, with poor spelling, a person may write what they hear phonetically. So when they're asked to spell the word little, L-A-T-T-L-E, they'll write what they hear phonetically, little, L-A-T-T-U-L. There also may be wrong sounds or added or missing syllables. So there might be difficulty in hearing and deciphering between the word light and right. The L and the R sound can be very, very similar, so there can be that difficulty in hearing the correct sound. Symptoms of auditory integration deficit include difficulty reading or writing efficiently, despite knowing the phonics, and asking many clarifying questions before starting a task. Interestingly, auditory integration deficit is found in almost all cases of auditory processing disorder. And this is because it takes so much time to comprehend what is being said. Symptoms of prosodic include missing the big picture despite having all of the facts or the details. There might be a misjudging of the speaker's mood, and then a person who falls under the category of prosodic include struggling with cause and effect reasoning. And then symptoms of organizational deficit include difficulty with sequencing. With this, a person struggles not only with language, but also with multiple step directions and the ability to manipulate and sequence materials in a meaningful way. For example, a person with auditory processing disorders that fall under the organizational deficits may struggle with math. Um, a person may be given instructions on how to do it, but they're focusing so much on what is being said that then the ability to do the math work is really, really difficult. And they just struggle to do that. A person with auditory processing disorders may have difficulty with paying attention, the ability to comprehend or follow someone who speaks quickly. There may be difficulty with understanding what is said if there is a noisy background. They may have difficult time knowing where sound is coming from. And phone conversations and following multiple step directions can also be difficult. Learning new languages and complex directions may be another difficulty for people with APD. A person with an auditory processing disorder may also take a bit longer to respond. They may ask for repetition. They may misunderstand what is being said and misunderstand messages. There may be inconsistent or inappropriate responses to questions or in conversation. A person may also demonstrate poor musical skills, including singing and playing an instrument. They may have difficulty with reading, spelling, and learning. And it wouldn't be uncommon for a kiddo to appear fidgety or overwhelmed in noisy situations. An interesting fact is that 5% of school-age children actually do have an auditory processing disorder, and approximately 43% of children with learning difficulties actually do have auditory processing disorders. So I found this table on understood.org, and I feel that it does a good job of depicting behaviors that we see at home and school. And then they follow up with possible issues as to why a specific behavior is happening. And it all does relate to auditory processing disorders. Since it is a little bit hard to read on the screen, I'll go through it, step by step. So the first one is, you might see a kiddo who can't stand the noise. So at home, your kiddo won't let anyone talk, even quietly, when they're maybe watching TV. At school, your child has difficulty working in groups because too many kids in the room are talking, or too many people in their group are talking. And the issue behind what you may see with they're not being able to stand the noise is kiddos with APD can the APD makes it hard to pay attention if there's background noise going on. Another concern or another area that is noticed is the kiddo with APD appears to be not interested in books. So at home, your child won't read out loud for you. At school, the kiddo dreads reading and sounding out unfamiliar words in front of classmates. And maybe the issue or the concern is that kids with APD often struggle to understand how different sounds work together to form words. So they just might be very apprehensive to want to do anything verbally. There might be a little bit of an embarrassment factor there too. And it may appear that your kiddo keeps forgetting things. So maybe at home, you're seeing this through your child seems to not remember people's names. At school, your kiddo can't remember basic math facts and may forget instructions. And maybe the issue or the core concern is that kids with APD might find it difficult to recall information they've heard. And then finally, a kiddo seems to have poor conversation skills. So a kiddo at home may appear to have trouble expressing their emotions. At school, the kiddo has a lot of difficulty answering questions and discussing ideas. The issue is that kids with auditory processing disorders often struggle with oral communication. So it's not that there is poor conversation skills, it's just that the fact of oral communication is a huge struggle with our kiddos. The causes of auditory processing disorder it's caused by a few different things. First of all, APD may be hereditary. It can also be caused by brain damage, such as a head injury, stroke, brain tumor, or meningitis. Auditory processing disorders could also be caused by a lack of oxygen. So if a kiddo has a jaundice or a brain hemorrhage, there is that lack of oxygen, which then could play into or lead to an auditory processing disorder. And then finally, APDs could be caused by chronic ear infections. So it is important to get a diagnosis for APD. So what you're going to want to do is to, on the home front, gather information regarding what is seen and how it has been affecting your kiddo. So you'll want to write down, you want to keep a log, write down what you're seeing just day to day with your kiddo. And this can be at home with what you're seeing, then talk with your teacher or daycare provider, if you've got one, just to know how it's affecting them, what the or daycare provider is noticing at the respective facilities. Write down what they're telling you, write down how it's affecting them on the daycare front or the school front. Keep that log, and then speak with your family doctor about what is being seen at home, at school, at daycare, etc. When you're meeting with your doctor and discussing these issues, share the impact that it has on your kiddo. The doctor may want to rule out other disabilities such as ADHD and hearing loss. Then once these are ruled out, the doctor may make a referral to an audiologist to determine if what is being seen on these different areas is an auditory processing disorder. Typically, the audiologist will test a child between the ages of 7 and 8 years of age, since this is when a person is typically able to understand and follow directions. An audiologist will perform many different tests to determine the type of auditory processing disorder a person may have. If you remember from a few slides ago, there's a handful of different categories that fall under auditory processing disorders, so they'll want to find which specific type your kiddo is demonstrating. Just to have on reference for you guys, there are a few different places around the state that do have audiologists. So in the Grand Forks area, there's Fire Audiology and Altru's Hearing Center. In Fargo, there's Catalyst Medical Center and Lucid Hearing. There's also Lucid Hearing in Bismarck. Bismarck also has Sanford Hearing Center. And then in the Minot area, there is Shower Hearing Aid Center and then the Professional Hearing Services. So if you do have questions about, where to go, do reach out to your posted op coordinator. They'll be able to give you these resources as well. So we'll jump now into how auditory processing disorders affect people. Academics for our kiddos might be a challenge. There might be difficulty following along if there's a noisy background, leaving the learner to miss parts of a lesson. Reading, writing, and math can be difficult for someone with an auditory processing disorder. So with reading, if a kiddo can't clearly and adequately hear and process the letters to make words, they'll struggle to recognize them. Reading comprehension can also be a struggle as kiddos with APD take so much time concentrating and decoding what's heard that comprehending what they're hearing is lagging. And then writing can also be difficult as naturally reading and writing go hand in hand. We learn some of the basics of grammar and the written word through reading. And then surprisingly, math can be difficult as well. With listening to instructions for math, a child may spend so much time listening and decoding to what is heard that somebody who does have APD may struggle with manipulating what is being taught to them. And so just similar to, like what we said about missing parts of the lessons or whatnot, or trying to process what is being heard, there's a huge lag because they're focusing so much on what is being said. And so our kiddos will struggle with recognizing those patterns and sequences in math. And then they'll have a hard time like learning their multiplication tables. And then not only that, there are also difficulties in learning about like the sequentials and higher learning math. Another thing that we have to worry about with our kiddos is that they may feel embarrassed in the classroom. And this is because it's taking so much time to focus on what is being said that they might not have that immediate response if they're called on. And then our kiddos may come home and homework may be a challenge. Our kiddos may just be worn out from taking so much time and so much energy on trying to listen and keep up with the day that they just may be exhausted at the end of their school day. And then our kiddos might not have heard or understood homework assignments. And then our kiddos may just have difficulty following lessons that are taught in class as well. Making friends can be difficult for kiddos with an auditory processing disorder, as it can be difficult to keep up with conversations. And adults can also struggle if they have an auditory processing disorder. For example, in day-to-day conversations, there might be difficulty, following along with that conversation, or there might be difficulty hearing names or remembering names after they've met somebody. A person may feel like they're missing out on something. And then also at work, people who have APD may have difficulty following multi-step directions or multi-step tasks. And then, if their boss does call to talk to them, first of all, who doesn't get anxiety when their boss says, I want to talk to you, I want to talk to you in my office. But the person with an auditory processing disorder may have difficulty distinguishing that tone of, hey, you're in trouble versus, hey, I just have a few questions for you. So they might cause a lot more uptightness or anxieties because of that difficulty differentiating the tone of voice that the boss is using when they say, hey, I want to speak with you in my office. There are no medications that can be taken for an auditory processing disorder. However, there are therapists, doctors, and lifestyle changes that may work well for somebody who has an APD. First of all, a speech language therapist may be able to teach some techniques and give tools to people to help them out. Some of the things worked on include training the brain to differentiate between sounds in various settings of noises. So they'll be able to just kind of help train the person. Like if there's a noisy background, they'll be able to help train the person to like focus on the person that is speaking to them. These therapists also work on helping the individuals ask for repetition if it's necessary. An audiologist will work with an individual through sequencing routines to strengthen the listening muscles. And a person with an APD may need to make some lifestyle changes to assist in becoming more successful. One of the ways is to learn some relaxation techniques. And then practicing these techniques can help clear the mind before they have to communicate. They may have to resort to emailing as a means of best communication practices for them. And then if you're a parent who is parenting a person with an auditory processing disorder, by all means, please join a support group of other parents who are raising kiddos with an auditory processing disorder, because you might find some more accommodations from families that have worked with this. They might have some additional tips and tricks and tools for you. So at home, when you're working with a kiddo with an APD, day-to-day lifestyle, you can speak slowly, enunciate your words, ensure that you're facing the child when you're speaking to them. It's important that you're being direct and concise with what you're saying. Allow for the child to work in a room with fewer distractions. So, if a kiddo does come home with some homework, or if they're, having 20 minutes of reading time at home, allow them to do this in a quieter room where there will be less distractions. And then play games with your kiddos. Who doesn't like to play a game? Games can really help boost auditory processing. A really good game to play with this would be Simon Says. And then develop routines with your kiddo. So practice routines at home. So they'll know, I'm going to school and I need to grab my lunch pail to go to school. I need my backpack, I need my shoes, and I need my jacket. And then really help your kiddo, have these routines at school too, so they are coming home with all of the things that they need. And then at school, continue to advocate for your child, whether you know that your child will be better if they sit up front, or if there may be a spot away from the window, or a spot that with less distractions. Advocate for your kiddo, whatever that may be, so they're able to process auditorily what's happening and what they need to pick out. Allow for there to be less distractions at school. Kind of talked with their teacher, with the teacher about this. Assist the teacher in having both visual and verbal instruction while they're teaching. Maybe give the teacher a few pointers of, like help pick out the main facts so the kiddo can hear for those certain words during that instruction time. That might help the kiddo pay attention a little bit better. And then plan out breaks. To ask the teacher to plan out breaks to give your kiddo just a minute to regroup, because they do spend so much time on trying to hear what's happening, that a break for them to just gather their thoughts and to just be a kiddo for a minute and regroup can do a lot of good. And then your kiddo may do better with having a microphone and headset, because it can help drown out the background noise, but really focus in on what the teacher is saying. And another key point is that your kiddo may qualify for seeing a speech language pathologist, and if they do, by all means, utilize this as well. Next, we'll jump into discussing processing disorders. So first of all, we'll start off with visual processing. Visual processing is how the brain interprets and understands information that is seen with the eyes. This leads us to know that visual processing disorders is the difficulty in interpreting and understanding information that is seen. So it's important to note that visual processing disorders is not the same as a visual problem. So a person who has poor eyesight, a person who has vision difficulties, will need corrective lenses. But a person who has visual processing disorder can have great vision. It's just that difficulty with interpreting what is seen. So a person can have 20/20 vision and still have a visual processing disorder. And then interestingly, studies have shown that 1 in 4 children in the US struggle with vision problems that affect learning. Therefore, it's important to figure out if it's eyesight that's the issue, or visual processing disorders that's the issue. And then Again, like I did for auditory processing, I'll interchange VPD for visual processing disorder, and then I'll also reference visual processing disorder too. So if you hear that VPD, know that I'm talking about visual processing. So there are 8 different types of VPDs. Visual discrimination issues include difficulty seeing the difference between similar letters, numbers, shapes, or objects. A person may struggle to sort game pieces or toys by shape and color. Visual figure ground discrimination is when a person struggles to see the difference between a shape or letter from its background. An example is when a person with visual figure ground discrimination might not be able to see, or they might not be able to find Waldo when looking in the book, Where's Waldo? Visual sequencing issues occur when a person has difficulty seeing letters, shapes, or words in the correct order. So this might be seen with skipping lines or reading the same line over and over again. Visual motor processing issues may include difficulty with what they see to coordinate with the way they move. So somebody who may struggle with visual motor processing, they may be seen with bumping into walls or the inability to write within the lines. There are long or short-term visual memory issues, and this includes a struggle to remember shapes, symbols, or objects. Difficulty with the recognition or letters or words make it difficult to read and write. Visual spatial issues are the difficulty in understanding where objects are in space. So a person is unsure how close objects are to one another. They may think that there's enough room to squeeze through a tight spot. And then there is visual closure issues. And this is the difficulty in identifying an object when only part of it is showing. So if they are shown half of a stop sign, they might have trouble knowing what the other half of that symbol looks like. They'll have trouble knowing that it's an octagon, despite the fact that they've seen a stop sign many times. If they're only shown half of it, they'll have difficulty correlating that other half to make an octagon. And then lastly, there are letter and symbol reversal issues. And this is when numbers and letters are switched when writing. So an example of this may be switching the letter B for boy, and actually switching it for a D as in dog. Or they might be seen flipping an M for the letter W. Some signs and symptoms associated with VPD include difficulty with seeing the difference between similar letters and numbers, difficulty accurately copying drawings or words, and difficulty with sign words. A child may avoid puzzles. They may struggle with letters and numbers, reversal of letters or words, as well as potentially inverting them. This can be seen with reading and writing. A key point to consider is this may be typical for a younger child, but is not typical for a kiddo who might be 10. And then finally, noticeably low quality written work. And it's important to note that a person has adequate fine motor skills, which is why the quality of work is abnormal. And then here is another document found from understood.org. And so, excuse me. So we may, we may have what appears to be poor memory. At home, your child may keep forgetting the phone number for their best friend. At school, your kiddo may not remember how to spell common words that have irregular patterns, such as there and there. Kids with visual processing issues might have trouble remembering things they've seen. Professionals might call this weak visual memory skills. Your kiddo may demonstrate difficulty looking up information. So at home, they may struggle to find phone numbers in a printed directory or in a phone book or a list. At school, a kiddo may have trouble with an open book quiz. The issue is that kiddos with visual processing issues can have difficulty finding specific pieces of information on a printed page. And then finally, our kiddos may seem like they're always getting lost. At home, our kiddos may have trouble telling another parent how to drive to their house. At school, our kiddos may be prone to getting lost in the hallways at school. And the issue is that our kiddos with visual processing issues have trouble with spatial relationships, telling how far things are from one another. This can make it hard to follow or give directions. The causes of visual processing disorders are unknown, which hopefully soon we'll be able to figure out why there is a cause of visual processing disorder. But currently we're just not sure what that cause is. So getting a diagnosis for a visual processing disorder, similarly to auditory processing disorders, it's important to keep a log of what you see, and in that log also document the frequency of what is happening, and then write down anything that may be leading up to it. And again, speak to your child's teacher or daycare provider about what they're seeing and make note of this. An important step to working with a visual processing disorder, getting that diagnosis, is to see an optometrist. This will help determine if the child has difficulty with their vision alone. Again, a kiddo that has 20/20 vision or that sees just fine can have an auditory or a visual processing disorder. So it is important to see that optometrist. And then once it's ruled out that things are fine on the eyesight side after visiting that optometrist, it's important to seek out and get a visual processing assessment. These are performed by neuro-optometrists. These assessments are research-based and they are age-appropriate and specific to look at what is really happening with your kiddo and what's where there might be like a hang-up or a lagging concern. This will help in identifying how a child both perceives and processes visual information. And then with a diagnosis, a treatment plan can be put into place, which will help the child become more successful, will help the kiddo become more successful as they learn how to work through having that visual processing disorder. And so in Fargo, there is a neuro-optometrist who can be found at Sanford South University Eye Clinic. And then there's also a neuro-optometrist at the Eye Clinic of North Dakota in Bismarck. So which is nice is that both sides of the state, the eastern and the western part of the state, do have a neuro-optometrist. A kiddo with a visual processing disorder may have difficulty with their learning. And this can be seen with reading, writing, and math. These three subject areas might be especially difficult. With reading and writing, a child with a visual processing disorder may be lower than average, but their oral abilities will be fine. Math is difficult as steps in a math problem are missed. Math symbols such as the plus or minus sign are omitted, and signs that are similar can be confused. So that plus sign might be confused with the division sign. So those signs that are very similar could be confused. A child may have lower self-esteem. This can be since they may recognize that they're learning differently than their peers in their class. And then their confidence will be less as well. And then looking at supporting a kiddo with a visual processing disorder, look at getting book accommodations such as large print books or audiobooks, as these may take some of the stress away for our kiddos. And then find classroom accommodations as well, such as asking if the kiddo can give an oral report versus a written report. And have the teacher write boldly when they're using the chalkboard or the dry erase board. ask for instructions to be both oral instructions as well as written instructions, and then ask for the usage of simple diagrams to help make that point. And then ask if there might be a friend who would be willing to do some note taking. There are some simple tricks for kiddos with visual processing disorders as well. So if the kiddo is needing to read, you can use a piece of paper with a cut in the middle to help the kiddo follow along with where they're at on the page, or even using a simple ruler to kind of help track the line of where they're at as well. And these can be super easy and inexpensive tips to help the kiddo keep track with where they're at. Some of the games that help kiddos with visual processing disorders include I Spy, sorting games, so have them sort by size, by color, by shape. Puzzles can also help. Word, letter, and number searches are another fun way to kind of help your kiddo who has a visual processing disorder. Memory games and board games like checkers can also be beneficial. Vision processing therapy is one way to treat visual processing disorders. This works on improving a person's working memory and visual processing speed. Results are seen with improving neural timing. So this helps a person focus, process language, balance, play sports, and read. People who have VPD also learn various techniques that will assess them in becoming successful. And then last but not least, we will review sensory processing disorders. So sensory processing is the ability to organize sensory input and apply it, which leads us to sensory processing disorder. It's the inability to make sense of the sensory input into the body. So an example of sensory processing, so the first one, sensory processing, if typically, we touch a hot stove, we remove our hand quickly because of that hot burning sensation and it's uncomfortable. But if there's a sensory processing disorder and a person touches that hot stove, there may be a slow response time to remove the hand. And that's because there's a disconnect between, that touch of the hot stove and that uncomfortable feeling. So the person with a sensory processing disorder might leave their hand there a titch bit longer than somebody without a sensory processing disorder. And then sensory processing disorders are not the same as autism. They're not the same as ADHD. They're not the same as ADD, and they're not a bad behavior. Although their sensory processing is not the same as these disorders, they can a person can have both. So a person may have autism and sensory processing disorder. A person may have ADHD and sensory processing, but they're not one and the same. They're different. And then there are different types of sensory processing disorders. It can be categorized into three separate categories. So the first one, there is sensory modulation disorder. And within that, there is sensory over-responsivity. And this is when someone is overly responsive to a sensory stimulation and might have a big behavior when they're set off. A child may try to avoid sensations or they might minimize them. There is sensory under-responsivity and sensory-based under-responsivity. A child may not respond to stimuli in an appropriate manner. So they may appear to be under-aroused, lethargic, or withdrawn. And then finally, there is sensory craving. A person who craves sensory input appears to be obsessed with getting more sensory input. So there is visual. So there, flashing lights, spinning objects, prefers TV and video games. There's just that crave for visualness. There's auditory, so uses loud voice, makes background noises, enjoys noisy environments. Taste, there can be seen with licking or chewing non-food objects, bites on many objects, smells people, animals, or objects. sometimes prefers one type of food, such as spicy, sour, or sweet. There is vestibular, and that's when there's that craving to spin or wants to swing and engages in fast activities such as biking, running, skiing, or roller coasters, and wants to be held upside down or tossed in the air. And then there's also proprioception, and this is obsessive jumping, crashing, and pushing into things. Um, they're unhappy unless clothing is tight-fitting, likes to wear weighted vests, grinds teeth. And then there's tactile, and this seems to um, there under tactile there seems to be an inability to stop with constant touching, feels textures everywhere. There might be a little bit of messiness. And then the second pattern found under sensory processing disorder is a sensory motor disorder. Um, the first one is dyspraxia, and this is where there's low muscle tone and difficulty with both fine and gross motor skills, and they appear to maybe be a little bit disheveled. So their shirt may be maybe buttoned incorrectly, their pants might be slightly twisted, might have difficulty jumping, skipping, or playing sports that require a ball. They may be clumsy because not only do they have difficulty with their motor skill, but then also difficulty with planning ahead. Um, and then also under sensory-based motor disorder, there's also postural disorder. That's the difficulty stabilizing their body, both with movement and at rest. There's a difficulty with keeping good standing or sitting position because there's poor control of the body. And then the third pattern is sensory discrimination disorder. And this is where there's difficulty understanding what is seen, heard, felt, tasted, or smelled. There's even difficulty in noticing differences in things that seem similar. So hearing the differences between certain words that sound similar. So, for example, hearing the word cat, the animal cat, versus a cap, what you wear in your head. And then there's a need for extra time to process sensory stimuli. And then some signs and symptoms of sensory processing disorder. There's difficulty with language development. There's difficulty with boundaries, motor coordination, spatial coordination, pain tolerance. So a person might have a very high or very low pain tolerance. There's difficulty with engaging in conversation, learning new things, and then language development is also a difficulty. And then it's important to note that with motor coordination and spatial coordination, a kiddo may bump into walls easily as they're walking, or they may be tripping over things continuously. Individuals with SPD may also be overly insensitive to their environment. They may be sensory seeking. They may be hypersensitive to hearing. There might be a touch aversion, or they might be overly aggressive. There was a study done by Sasson Carter and Briggs Gowen. They found that 1 in every 6 children experience sensory symptoms that may be significant enough to affect functioning in everyday life. A specific cause for sensory processing disorder hasn't been found yet, but there is a hypothesis as to what can lead to having a sensory processing disorder. Those hypotheses include low birth weight, prematurity, trauma, and the environment of which a child grew up in. And interestingly, I recently listened to a podcast where an adoptive mother, was talking about the trauma piece being a factor that could lead into her kiddo having some sensory processing disorders. She was explaining that, during a typical development of a child, after they're born, the baby cries, their mother comes over to soothe that issue. So if there's a dirty diaper, their mother changes the diaper and rocks and cradles and holds the baby until they're soothed. if the baby is crying from hunger, the mom, provides that nourishment for the child, and again, meets the need by gazing into the kiddo's eyes while she's feeding and snuggling the baby and pats the baby on the back, which is providing that comforting touch. And then she also talks to the baby in a soothing and loving voice, which provides comforting verbal intake. These actions not only provide that attachment with the kiddo, but also play in assisting with appropriate sensory input. But then our kiddos who come from a home that may be a little bit more chaotic, they might not have their needs met. So when there's crying, either their needs are not met at all, or they're done so that's not appropriate. It takes too long, and they might not have that soothing voice, that comforting rocking that their needs met. And so that may be the environment that affects the sensory input. So our kiddos may be lacking in sensory input if they do come from that, trauma background. And I think it's just important to consider, for our kiddos that are adoptive and in foster care, just as their sensory needs might not have been met in their prime years of early development. Getting a diagnosis for sensory processing disorders, again, as it's been encouraged for the previous two, I encourage it again, keep a log with what you're seeing with behaviors relating to sensory input. So you might want to include the time of day of the meltdown, what leads up to the meltdown, what behaviors you're seeing, how long the meltdowns last. When you have your kiddo evaluated by an occupational therapist, make sure that you're provided with a packet to fill out by the OT. This packet will help the occupational therapist kind of grasp a bigger sense of what's happening. And then also be sure to bring that log with as well, because it will, again, provide more information for the OT to consider when diagnosing your kiddo. And then it can help to jog some of the memory that you have of behaviors that you're seeing relating to sensory processing. Some of the really good OTs in our area include Sanford, Great Kids Therapy, and Pediatric Partners in Fargo. In Grand Forks, there is Little Miracles and Alters Pediatric Therapy. In Bismarck, there is the Red Door Pediatric Therapy and Pediatric Partners Clinic. And then finally in Minot, there is Minot Center for Pediatric Therapy, Trinity Health Pediatric Occupational Therapy, and then the Minot Center for Pediatric Therapy. How people with sensory processing disorder are affected. Foods. There are foods that can be offsetting the texture of foods. Clothing, the texture of clothing again can affect a kiddo. So, the materials of jeans or the material of joggers can really affect our kiddos. They may prefer to only wear silk shirts. Playtime. During playtime, our kiddos might not want to explore as much as a kiddo without a sensory processing disorder. They might not like the texture of sand, mud, or Play-Doh. Interactions with others might be difficult. Sounds of voices might be too high. It might be too much. And then noises in various settings might be offsetting, such as at playgrounds, gyms, or assemblies. Occupational therapists work well with individuals with sensory processing disorders. In a controlled setting where it's quiet, they can work on coping skills with individuals when exposed to specific stimuli that needs attention. And this allows for individuals to build a tolerance and have skills that will help them in day-to-day life. Another technique is the Wilbarger protocol, and this is brushing a particular part of the body, followed by joint pressure. So it might be, brushing the arms or the legs with joint pressure on the elbows, wrists, or knees to follow. Another technique includes a listening program where CDs and headphones are used. And this exercises muscles in the middle ear while doing various activities such as swinging, bouncing, or crafts. So it just kind of helps develop when exposed to different stimuli. And then occupational therapists will show techniques to help parents to help their kiddo at home, so that this helps a person with a sensory process disorder to become regulated in a space other than the OT office. So, you might be directed to create a quiet and clutter-free space in your home, and then you might be given tools such as a weighted vest or a blanket to help provide some pressure. You might be instructed to help calm. You might be instructed to also find chewable jewelry or fidget toys or pressure clothing to help provide some comfort for your kiddo. And then at school, you might have your kiddo go in a weighted vest or pressure clothing, and then also talk to your kiddo's teacher about fidget supplies that might be able to help them a little bit more and stay a little bit more focused. And then we are jumping into our last slide of now what. So remember just to keep that log of what you've been learning to help jog your memory when you are reviewing with professionals. And hopefully your professionals, your doctors, your therapists, etc., are doing a comprehensive overview of your kiddo's needs, but those logs do help jog your memory when you are giving a report to them. And then continue to learn more about the diagnoses, the triggers that set your kiddos off, and techniques that will help lead your child towards success. Continue to advocate for your child. If you know something seems to be different, continue to advocate for them, whether it be continuing to advocate at the doctor's office or continuing to advocate at the school setting. Advocate for appropriate treatment, and then advocate for support in all of the settings so your kiddo can be as successful as possible. And then also celebrate the successes that your child has, whether it be with improving in reading or advocating for themselves and needing more time to process or refocus. Also know that you're raising a child to become an adult, and that goal is to have them be successful. So continue to help them recognize the successes that they're having as a child and as an adult as well. I've also provided you a list of various books that might be beneficial in reading to learn a little bit more about your kiddo and what you might be seeing. And so just make note of and read these books as they might be an additional support for you. I did want to point out that the book that's called It's Tough to Be Gentle, A Dragon's Tale, that is more of a children's book, so that might be something that your child may benefit from reading, just to kind of help normalize with them a little bit more what's going on. So by all means, feel free to read and learn from this list of books as well.